Welcome to our video about Ebola. It's a part of our disease project. I am Cameron Purcell.
And I'm Katie Savaggio. The first thing we're going to talk about is the Ebola pathogen. Its common name is Ebola, while the scientific name is the Ebola virus, or what you see in the parentheses. It can also be referred to as EBOV. There are 4 stages in the life cycle: entry, uncoding and fusion, transcription and replication, which is where it really gets you, and assembly and budding.
The pathogen naturally is in various primates, and the virus is approximately 80 nanometers in diameter and 970 nanometers long. The pathogen is cylindrical, like most viruses, and contains a viral envelope, matrix, and nucleocapsid components. The rest you don't really need to know. The Ebola virus has a very odd shape, and it's captivated the internet, creating many memes. This one you can see was inspired by the Disney Channel. I think it is quite hilarious. Now let's move on to high-risk groups for getting Ebola.
Ebola spreads through contact of the mouth, broken skin, eyes, or nose from body fluids, or the host cells of primates.
A person that gets infected with Ebola will normally show no symptoms immediately, and it can't spread until the signs and symptoms develop.
Currently, all of the major outbreaks have been in Africa, especially the western and central region.
The people that are high risk for getting Ebola are the people who work with the body, so healthcare workers, family members, and mourners who are come to pay respects to the body.
The last major outbreak was in 2014 to 2016. There were 28,000 cases and 11,000 deaths.
Now we're going to talk about the symptoms of Ebola. Symptoms that appear and from 2 to 21 days after contact with the virus, and you can see all the symptoms are your normal disease symptoms, so fever, severe headache, weakness, fatigue, vomiting, and it's actually very hard to diagnose Ebola because the symptoms are so common. Pathology now. When Ebola is first introduced to the body, it targets specific cell types, including liver cells and other cells in the immune system, and the virus travels throughout the body, and the macrophages pick up the virus and make proteins that cause clots and other bad things to the intestines.
When the macrophages release proteins, inflammation occurs as a result, which can damage the tissue and the blood vessel.
How Ebola spreads basically is it's spread by direct contact of bodily fluids. As you can see, a list of all the bodily fluids that will spread.
Diagnosis can be difficult due to similarities between Ebola and malaria and influenza. In order to diagnose, there has to be a combination of symptoms and a possible exposure to Ebola within 21 days before the start of the symptoms. There is no drug currently licensed by the FDA in order to prevent or treat Ebola, so current method of treatment includes providing fluids and electrolytes, oxygen therapy, medication, and then treating any infections that pop up.
The treatment relies on good care and the immune response in the person, and because most of the outbreaks occur in Africa, there's a poor health care in hospitals, so people have a harder time recovering, and it often results in death.
7 to 10 days after any infection appears, half of victims experience low blood pressure, go into shock, and then die. Out of all of the outbreaks of Ebola, there's been about a 90% death rate.
There isn't really a cure for Ebola. However, most people that have gotten Ebola become immune after they've went through it, but that there's always that chance that they could pass on Ebola after it lingers in their system.